Savvy Business Radio, drawing out the best from our guests with our host, Christina Nichman.
Our guest today on Savvy Business Radio is Lisa Barr, MD, #1 best-selling author and native of Virginia Beach. She is a seasoned physician with over 30 years of medical experience, and she has a passion for finding unique solutions for people living with painful conditions. Today, she shares her insightful new book, Outsmart Your Pain, the essential guide to overcoming pain and transforming your life. Get a copy of her book today at Lisa Barr, MD. That is LisaBarrMD.com. Hi, Lisa. Welcome to Savvy Business Radio. How are you?
I am great. Thanks for having me today.
Oh, you betcha. I was really excited when our good friend Joshua connected us because you've written a book that I know a lot of our listeners are going to need, including a lot of my friends, and that is Outsmart Your Pain, the essential guide to overcoming pain and transforming your life. And more than ever, a lot of my friends in their 40s and close to their 50s, all they're telling me is I got this pain, I got this ache, and this autoimmune issue. But you've seen in your practice as an MD that there's other ways to treat it than just a needle or surgery. And you've come through all of your experiences putting into this book that there's a comprehensive way to deal with it, not just one way, not just Eastern medicine, but modern medicine mixed with the whole package of understanding your body and working with it. Share what brought you to write your book.
Right. Not just understanding your body. That's certainly part of it, but also understanding your mind and your emotions. So what brought me to write the book is really a combination of life experience and work experience. So I've been in practice for 33 years. Wow. And I've seen over 200,000 patients.
Wow.
So what happens to a doctor like me at this stage of my life is one of two things. You either burn out or you reinvent yourself because you realize I've gained, what I realized was that I've gained so much wisdom and understanding and compassion that I wanted to put it to good use. And I wasn't ready to retire or, fold up and go away like a lot of my colleagues are doing. And, there's some challenges in healthcare today. And I think, it's easy for some physicians to succumb to that. And I decided I was going to take a different path. And I just wanted to be a guide and help people see a better way to navigate pain. And I think with the opioid crisis being just front and center today, it's just so timely. I think, hopefully my book will really help people understand why there is an opioid crisis, for one thing. And secondly, how to not fall into that trap, because that's a whole trap into itself. I think that some people suffer with chronic pain and they don't really know how to approach solving that problem. And then there are people, unfortunately, who get caught in the addiction trap. They're sort of different. They're different populations. And then I think there are some people who, as we, in the our day and age of information being so open and accessible, I really wrote the book as a way of saying, hey guys, all this information is out there, but I'm going to compile it into one resource for you and make it easy for you to understand. So, because some people have chronic pain because maybe they have just an old injury that never heals, and so they start compensating, walking funny, sitting funny. They don't realize it. They're not aware of it. And then compensation patterns just pile up. And then before you know it, their bodies are just such a hot mess because the body can't function efficiently anymore because it's just compensating for that original injury that just never healed properly. And so that concept is the physical aspect of pain. And then there's the mental aspect of pain. You and I were chatting earlier about, some of us have different personality types. And one of my mentors, John Sarno, who practiced in New York and is rather kind of a celebrity doctor. He's now deceased. He just passed away recently at the age of 93 or 94. Yeah, he practiced into his 90s.
God bless him.
Yeah. He was one of the first mind-body medicine people, way before his time. And he used to feel one of his great contributions was how perfectionists, those of us who are highly intelligent, accomplished, driven, really movers and shakers, implementers, entrepreneurs, business owners. We're constantly making things happen. Well, sometimes that drive comes from sort of a sense of perfectionism, and that can have its root from early childhood things or just our natures. It's just what it is. It's nothing to be judged. It just is a potential risk factor for pain. And so Sarno was the first to really explain that. And I do give him lots of kudos in the book about that. But he used to basically say that, people who had chronic pain were either perfectionists or they had some maybe early childhood trauma, abuse or abandonment issues, or maybe were raised in a home where there was addiction. So there were some risk factors. So there's the sort of mental part, which is the perfectionism, overthinking, overanalyzing, sort of someone who's maybe tends to go into the negative all the time. We call it ants, automatic negative thoughts. And then there's the physical, we talked about the posture, and then there's the emotional piece, which would be some of those difficult, challenging early childhood, or even not so early, even we see with the Me Too movement, women who maybe in college had some difficult experiences, even men. I mean, I think, so now everything's out in the open about what can happen to us sexually or socially, bullying. I mean, it can take many forms, but these things impact us. And if you don't develop good coping strategies as you evolve, as you grow up, then these emotional difficulties can actually manifest physically in certain holding patterns within the body. There are certain postures that we see, certain breathing patterns that are apparent. It's just amazing how, someone will walk into my office. I had a 46-year-old woman who's a marathon runner who looked like the picture of health, sort of. But she comes in, she's, seen 3 different pain specialists, 2 different chiropractors, 3 different physical therapists, a nutritionist. I mean, you name it. And all of a sudden, and her husband is a hospital administrator in our area, and he had heard about my book. So, of course, he pulls her into my office and he says, okay, now you need to figure this out. And so, I just looked at her and I started just asking her some questions, but I could see from her posture what the problem was. And it was interesting. She had absolutely terrible breathing patterns. She had no core muscle function. And so she kept getting overuse injuries in her legs and in her arms because she had no central core strength and she had no real structural resilience. So she just kept injuring herself because if you lack that sort of core strength and effective breathing pattern, then when you run, you're just using your extremity muscles. You're not actually running efficiently. Wow. And this is true of any activity that's a repetitive thing. So that's part of why people get repetitive motion disorders or repetitive strain kind of things, whether it's tennis elbow or rotator cuff tendonitis or hip issues. A lot of it's just overuse when you get the core engaged and you correct their breathing patterns, which I talk a lot about in the book. I mean, it's just, I say, look, this is so simple. You can learn this in 5 minutes. And if people just implemented these changes, I mean, it would really completely change our healthcare system. Wow. And it would empower people to realize that they don't have to take a pill for every ill. They can actually just make subtle changes in how they move, becoming more aware of their breathing patterns and their posture, and looking for these old compensation patterns, and then seeking out, the right kinds of physical therapists and people who can guide you. Because unfortunately, most people don't have good body awareness unless you're a dancer.
I know. I don't.
Yeah. You've done a lot of Feldenkrais, or that even people who do Pilates and yoga don't have good body awareness. It's really interesting. So I teach a lot about that in the book. And
So I'm sure working through and learning all this through your practice and over many years of bringing it into your life, I'm sure it's made you more healthy as well.
Yeah. So to actually tell my story in the book, when I was 41, I was out with my children on a friend's boat that ran aground suddenly as I was actually trying to walk from the stern of the boat to the bow of the boat. And as the boat struck the sandbar, I became airborne and literally flew through the air, landing headfirst on the bow of the boat. And I blew out couple of discs, and ended up with a spinal cord injury. By the grace of God, did not fly out of that boat. I guess that wasn't my time. But that started me on a 10-year journey of really trying to piece all this stuff together. I like to say that I've always considered myself my own best guinea pig. So, our lab rat, whatever you want to refer to, but you know what I'm saying. So I think everybody kind of saw themselves and almost in it with a sense of curiosity and joy. Like, this is interesting. So this is about me. This is about each individual, and I'm going to try different things to see what works for me. What that does is that empowers you to be in your power, to own your healing, as opposed to giving your power away to a doctor or a chiropractor or physical therapist. I'm going to tell you, we all need help. Okay. So we need to find the right help, but you can't give your power away to these people. So as soon as you do that, you have disengaged your greatest asset, which is yourself. Mm-hmm. So, I had to learn that, and I tell my story in the book and sort of the path it took. It was a pretty circuitous path, and there were times when I went off and learned all kinds of things from breath work to mindfulness-based stress reduction to shamanism. I mean, I just decided I wanted to understand the healing mechanism on every level. And then once I did that, it was really quite interesting, because then I had to figure out how to explain it to somebody who hadn't taken the journey. So I like to say it's the sort of hero's journey to health. And if you're aware of Joseph Campbell and the myth of the hero's journey, there's a certain sort of cycle to that. But originally I was going to actually write the hero's journey to health as a book. And then I realized that very few people would understand what that meant. So being a pain specialist and having had my own experience with pain, I said, oh, well, I'm going to use that framework of the hero's journey, but make it relevant to today. Mm-hmm. And that's really when I changed and wrote this book instead. And but I believe that Joseph Campbell was really understood the human condition. And I think that the takeaway from that is that either we are stuck in victim consciousness and believe that other people are going to solve our problems, or we're going to be a hero of our own story, and we're going to figure out what that takes to actually become empowered. And I think as business owners and entrepreneurs, we're wired that way anyway. I'm always been self-employed myself, and I had the opportunity this year to decide whether I wanted to go work for a big orthopedic group, and that just wasn't going to work for me. So I took, but I do think that some people are very quick to give their power away because they believe that someone else can help them more than they can help themselves. And I think in the book, I really try to work off of the empowerment platform. And as you and I were talking earlier, a lot of that is just overcoming your subconscious blocks. Your mental and emotional and subconscious blocks, these little negative messages that tell us we can't do something or that somebody can do it better. But yet once you understand how, it's almost like, I believe that the book is kind of like an operating system. So it sort of explains to people, this is really what's happening inside of you. And so once you understand it, you can outsmart it. If you don't understand how something works, then it's hard to solve your own problems. You know
what I love about this, Dr. Barr, is that when you think about this, my partner, my husband, is an expert in many different things. He's built computers. And when I met him, my computer was a wreck. And he said, I can build you a better computer, and we can, give you all the bells and whistles, all the memory you need. And he said, watch me. It's not that hard. So we've now built 3 of them together. And when you see the inner working of getting the bits, now it does take some know-how. You got to make sure you get the right bits to plug them all together, or it's not going to work. Right. But it's not as complicated as you think. And for years, you're like, oh my gosh, all these inner workings. Oh, you couldn't possibly do it. But once you do the homework and you get the proper bits and you put them together, you're like, wow, it really works. And it leaves you feeling empowered. And a computer breaks down, I can troubleshoot it. I know what's inside my computer. It's the same thing with your body. Once you start to get an understanding of certain things, it's not so, mystical. I couldn't understand any of it. It begins to give you a sense of empowerment. Yeah, and I think it makes a lot more, it's a lot easier to find the right people to help
solve a particular problem.
Mm-hmm.
And I really believe in my heart that, we are going through a healthcare crisis. It's just sort of starting. I think that things are going to kind of blow up over the next 5 years or so. And I do think there's going to be a sort of swing of the pendulum back to less drugs, more holistic and health-oriented, educational-based programs.
But what's the crisis in your mind? Is it just that people are just totally depending on their doctor in Western medicine and taking pills, or where is the real crisis? Or is it just that, because also I'm hearing from a lot of people that they feel they can't get the proper care because it's so expensive, and then doctors are telling me I want to heal people, but I can't. I'm being stopped by insurance company. Where are the biggest issues you're seeing?
So I think that, first of all, from a philosophical basis, our healthcare system is not a healthcare system, it's a sick care system. So that's the essential foundational problem. If the healthcare system were really a healthcare system, it would be teaching people how to stay healthy.
Yeah.
So there's already, if you're running a business and your purpose of your business, your mission statement is completely contrary to your business model, then you could see that there would be a problem there. Mm-hmm. So that's the essential problem. So that said, we have all been led to believe that you can diagnose pain on an MRI or an X-ray. That's not true. You can diagnose physical findings, or you can diagnose, radiographic findings on an X-ray or an MRI, and it'll tell you what the state of your anatomy of that particular body part is at that time. It does not tell you that that's what's causing your pain, though. But the problem is that it's much easier for a physician or practitioner, because nowadays you may not see a physician, you might see a nurse practitioner or a PA, mm-hmm. to say, oh, well, I see your problem. It's right there on that MRI. Now, let me tell you, I have people who have herniated discs, and I can smell those guys a mile away. They walk in, they have certain complaints, physical findings. I can tell them before they get their MRI, you got a herniated disc at L5S1. This is what we got to do. But the greater majority of people walk in, they don't have such an obvious set of complaints and physical findings. And so they come in, they might have had, X-rays, MRI scans, EMG studies, variety of tests to try to find the problem, and it's not clear. And I think the biggest takeaway I would say is that for those folks listening, if you're one of those people who you go to the doctor and nobody can really give you a straight answer as to what's causing your pain, or let's say somebody said, oh, I see that on your MRI, I see the problem, let's stick a needle right there, let me just make that go away. And if it doesn't go away, that's not your problem. And that the real truth is that the answer is not going to be found on the X-ray or the MRI. You need to start dissecting yourself, both on a physical level, mental and emotional level, to try to figure out where the root of the pain is coming from. And then you can start to solve the problem in the most efficient way. Mm-hmm. So the book really is a guide to help people figure out where they are. Is this more of a physical issue? Is this more of a mental issue? Mm-hmm. Am I kind of creating this because I'm just got this reverberating thing going through my head, which is causing me to have a lot of stress and tension? Mm-hmm. One of the other key points in the book is that stress and pain are flip sides of the same coin. And yeah, they are. And I explain on a neurophysiological level why that is true. Now, the problem is, so we talked about what's broken with the healthcare system. Mm-hmm. If our insurance companies and our employers and motivated people would just understand how stress affects them in a more realistic way, and people learned how to become more stress resilient, and they understood the effects of stress on their bodies, we would be able to reduce pain easily by 50% across the board in the population. So just imagine those people who who are totally stressed out, and they're walking around and they've got, chronic muscle tension. Yeah. They're breathing up here. They don't engage their diaphragm. They're constantly in a state of fight or flight response. And so, I explained in the book the whole neuroscience behind being stuck in fight or flight, what that does to your breathing, what it does to your digestive system, what it does to your muscles. And so the idea of stress is critical to understand. A lot of, not just pain, but most chronic illnesses, whether it's diabetes, hypertension, heart disease, vascular disease, autoimmune disorders, basically are manifestations of this dysfunctional stress response. So for example, if you have a lot of stress, by the way, there are felt to be 3 different types of stress responders. So there's the muscle tension stress responders, and those are the people walking around like this. Okay, so they have neck pain and headaches, tension headaches, and migraines. And then you've got the people who are vascular responders, and they're the people who have Raynaud's, they get migraines, they have cold hands and feet all the time. So their blood vessels are super sensitive to the cortisol and the other stress hormones. And then there are gut responders. So those are those people who get irritable bowel syndrome and gastroesophageal reflux, or we call GERD or reflux. And really, if people could understand, okay, well, let's see, am I a muscle tension stress responder, or am I a gut responder, or am I a vascular responder? Most people, by the way, are muscle tension or gut. Yeah. Most people. Okay. So, if you have any reflux or IBS, you're a gut responder. So if you start to realize, oh my gosh, if I learn how to manage my stress better, then all of a sudden my GI issues are going to get better, and then I can get off of the proton pump inhibitors, which by themselves cause a lot of issues.
Can I ask you something? Because I've gotten it under control, but I was diagnosed a number of years ago with Graves' disease. That's an autoimmune disease.
Yes.
Would that be a combination? Because I've had stomach issues along with I'm tense a lot. So
yes.
Can you have a combination of the two?
You can have a combination of the two. Absolutely. They're the 2 most common. And yes, you can definitely have combination. I mean, we live in a world full of chaos. I mean, whether it's the news. I mean, look, my dad called me this morning.
Turn it off!
About the shooting in the synagogue. I mean, just people going to synagogue, and 15 people got shot. 3 police officers who came on the scene just to, it's just insane. I mean, and then I think a lot of people, we get addicted to information. I'm guilty of that too. And so that creates stress. And, we've got multiple electronic devices that we're connected to all the time. And we're exposed to all this EMF, the electromagnetic radiation that we're exposed to. We're not really wired for that. So that's affecting us in some way. EMF, they call it.
I never thought of it.
So it's from our laptops, our wireless internets, our cell phones, our little portable devices, our e-readers. I mean, they all produce a certain amount of electromagnetic frequencies, radiation, and we don't realize the effects that has on us. And sometimes we just have to unplug. So all of these things, people don't think of it because it's just a way of life for us, but these create stress. They really create stress. And as soon as you experience that stress, it's almost as if your autonomic nervous system switches from a rest and digest mode to a stress, tiger chasing you mode. So now you're in threat mode, and there's a whole host of neuroendocrine, hormonal, and electrical charges that go through your body that basically wreak havoc on your system. So most autoimmune conditions and most chronic medical conditions have their root cause in that dysfunction. Wow. So what I learned over the time of the last 30 plus years is that if you can consciously learn how to control that autonomic nervous system by controlling your stress and threat response, then you can stay out of fight or flight. It's virtually impossible to be pain-free when you're in fight or flight. It's virtually impossible. And I explain why that is in the book. So the book is really based on neuroscience.
But you know what? I wanted to also hit on the importance you talked about earlier is the mind, because my husband has major arthritis, a type of arthritis since he's 23, that really the doctor's like, I don't know how you're not screaming in pain every day when I look at your x-rays. But he's like, I feel no pain. And I'm like, the doctor's like, I don't know, I'd be screaming. But he is such the most positive person I've ever met. And I really think it's his mind that keeps him relatively less pain or no pain.
Couple of things around that. I think, yes, you're right. I think some people have adapted with that positive mindset, and some people have the automatic negative thinking. So you have that sort of pendulum. So to sort of assess where you are on that scale. And the book helps you to kind of see, oh, well, wait a minute, I can do something about that automatic negative thinking. And so I think that's part of it. But keep in mind, there are genetic factors that influence your pain threshold. So you can have arthritis and not have a lot of pain. That science is there, but it's not available for the normal average person. But even through 23andMe and some of the other genetic testing, you can look at certain SNPs in your DNA that would say, okay, your pain threshold is going to be higher and maybe yours might be a little bit lower. Also, there's risk factors for addiction. These are similar genes that control pain threshold and addiction.
Wow.
So some of this is going to be coming out. So your husband may be one of the lucky ones. I happen to have a high pain threshold also. It's also linked to your blood type, but it's all genetic. So there's a big genetic benefit or risk, but you can't blame your genes, okay? So I'm not suggesting, I have low pain thresholds, it's all genetic. No, it's part of it. It's not the whole thing. Because of epigenetics, you can influence your genetics. I talk about that in the book.
Yeah, that's fascinating. And you mentioned the opioid crisis. And is that part of the whole flight or fight and that we don't deal with pain well, and so we're going straight for the drugs? How does that come about?
Well, I think the opioid crisis, that's a whole conversation in and of itself. But I do think that, unfortunately, that the trap of people getting stuck in fight or flight often, they go to the doctor and they're panicking. I mean, they're literally panicking because they're in misery. And the doctor, being a well-meaning doctor or practitioner, doesn't want to see their patients suffer. So they don't know what else to do, and they don't know how to counsel the patient. So, it's a slippery slope. So you start on something. And all it does, in the right patient with the right genetics and the right, sort of set of mindset, it just takes one prescription to get it started. That's the problem. Yes,
one
really.
Prescription, you could be addicted.
Yeah, and it can be for a dental procedure or a little minor surgery. It doesn't take much. If you're already on that slippery slope path, whether it's genetically or just emotionally or mentally or whatever it is, then it's just like boom. Yeah, it's really, that's why it's such a dangerous thing. These drugs are really, really, really habit forming.
So for the people who might be listening and they're not going to be broadcasting to everyone, hey, I'm addicted to XYZ painkillers.
Oh, yeah.
How do they even begin? Because I don't think you can just stop it. I think it could be dangerous, right? How do you begin to work towards stopping?
It's not dangerous to stop pain medication. What's interesting, this is kind of the side effect of withdrawal from opioids is increased pain. So that's what happens when people say, oh, I've got to get off these drugs. And so let's say I'm going to stop my, hydrocodone or my Percocet. And so they do. And what happens is their pain levels start to go up. That's a normal physiological response to sudden withdrawal of opioids. Oh. So then they go, oh my God, I really need this medication because, oh my God, my pain just went up dramatically. So that's what keeps people, one of the things that keeps people in the trap. So we counsel people, look, your pain is going to go up. That's what's going to happen. That's just expect that to happen. And so you just have to be prepared for that. Don't plan a trip. You need to take some time. If you're going to do this, we're going to wean you down gradually. You're going to know that to expect some transient increase in pain, but it's only transient. It's not a lasting thing. The problem is our minds quickly go into a fear-based reaction when you start to have that escalation of pain. And that's just sets your threat response, your stress off, and throws you back into fight or flight. So exactly what you were just saying. Mm-hmm. For people who are really addicted to much higher doses or stronger medication than, say, hydrocodone or Percocet, then, I highly recommend consulting an addiction specialist there, because there's something called drug-assisted treatment where you can go on what's called Suboxone or buprenorphine. And what happens there is that the addiction specialist will transition them onto this other medication called Suboxone. And then they can gradually wean them off the Suboxone. It's much easier to come off the Suboxone than off of opioids. So that's a strategy for people who can't just slowly wean off. So that's an option. And and then there is Narcotics Anonymous. So we know that there's a very effective 12-step program in place for people who have addictions. So there is, very similar to the Alcoholics Anonymous, there's something called Narcotics Anonymous. And those programs are pretty good, actually.
Awesome. So there is options.
Yes. Oh, absolutely.
You don't have to be stuck or embarrassed, because I'm surprised to hear that one set of pills could do this to someone. Because I don't, if you're, say, a person, I would never, ever be a drug addict, never. And then you get, go for a dental procedure, you get a container of pills, and oh my gosh, I'm addicted. So yeah, it's not something to be ashamed of. It's just. No,
yeah, absolutely not. I mean, I think, and unfortunately, look, it's a setup, the drug companies back in the 90s, I mean, they knew what they were doing when they put these drugs on the market.
And why are we the only country, I think besides one other one, that runs commercials for normal citizens to watch when we're not MDs? Right. And we're going to our doctor going, hey, I want this drug.
Well, the pharmaceutical industry is a very powerful industry.
Yeah, I'm seeing that. But that's why I'm glad that we're having this chat, because people can empower themselves and not be entrapped.
It's really about that. I mean, you just got to decide who you want to give your power to. You want to give your power to the pills or to yourself? Who do you want to become a victim of, pills or other addictions, alcohol, sex, I mean, even internet addiction. I mean, and I think we have to realize too that I know your audience is mostly business owners and entrepreneurs, and those of us who are wired to be the independent souls of the universe, we're like go-getters, implementers, and so we tend to have a strong drive system, and so we're pushing ourselves constantly to do better, to make more money, to make our businesses better, to empower our staff. But we're juggling all these things, and and so learning how all of that affects us physically, mentally, emotionally, and how to manage that balance of things is critical. And I talk about that in the book. And I think the critical piece is that we have this drive that really makes us successful in the world. But we also have this threat response, which is operating behind the scenes, and it's controlling our nervous system, but we don't know it. And then we have this other system where it's designed to offset the drive and the threat system, and it's called a self-soothing system.
That's interesting.
Yeah.
I've heard of that one.
Most of us are busy making our way in the world and trying to grow our businesses. So that's the drive system. We don't see the threats involved in what's happening while we're driving. Those threats basically it's a stress response, but it's taking a toll on our neuroendocrine system. So whether it's affecting your thyroid or your adrenal gland or your gut, it's having an effect on you. The problem is we're not trained to realize or recognize the early warning signs, and we don't know what's happening until all of a sudden we have a full-blown diagnosis. Oh, I have Graves' disease, or I have Hashimoto's, or I have Crohn's disease, or I have, terrible irritable bowel syndrome, or I have celiac, or I have a million different other things, diabetes, or, anyway, it's just rampant. And so if people understood just how they could learn to manage these three systems and to make priority, not just our business being successful, and pushing our way through the world, right? And just becoming uber stress resilient, so we think, because, we can just handle so much. But the truth is we all have a threshold for stress. Like, there's a threshold. You cross that threshold, what happens is you go into adrenal fatigue, you burn out your thyroid, you do all these bad things, and then you have to spend the next 10 years of your life repairing that. So the question is, do you really want to go down that path? Or do you want to say, hey, I'm going to learn how to balance this by self-soothing by what is it that I need, okay, to not allow the tipping point of stress and all those negative effects that happen on a neuroendocrine and electrical level, okay, tip us into ill health. And what I learned in my own life experience and in writing the book and in everything that went into writing the book is that pain is one of the great motivating factors in life, right? So you can kind of deal with constipation and diarrhea. You can kind of deal with, your thyroid going out because you're going to take thyroid medication. And you can take medication for constipation. But when the pain starts to escalate, everybody has a threshold beyond which they're just not going to tolerate that. And then that's when they go to ask for help. But pain really is just another symptom that something's out of balance. And so if you learn that, then it's really helpful.
Wow, this has been such an awesome, fascinating talk. And I know it's going to be one that benefits everyone listening. And whether you think you have a pain issue or a health issue, we go through different stages in life. And when I was going through my Graves' disease and it was not healing as quickly as I wanted, my doctor was like, well, look, it probably took 20 or 10 years for it to manifest. You can't
That's it.
Exactly. Like that. So it's going to take time to get back to equilibrium and get your body back in balance. Yeah.
That's it. And I tell my patients that, don't expect an overnight fix because, it's sort of however long it took for this to evolve is maybe how long it takes for it to resolve completely, for you to have mastery over it. I mean, in a sense, we're trying to teach self-mastery. And it just depends on how much effort you put into learning what you need to be in balance. Everybody's needs are a little bit different.
Yeah. And that's what's interesting. And I think if you're finding a doctor who says, hey, just shut up and listen to me because I'm the expert, then just go look for another one. There's plenty of doctors out there. I found a wonderful one in Manhattan that really is a wonderful healer. He wants to work with you. He doesn't want you to just be an idle patient, just lay back and let me do everything to you. He really wants you to be an integral part of your healing. So there's a lot of those wonderful doctors like you out there.
Thank you. Well, you know what? Like I said, I think that every physician reaches that fork in the road where they either burn out because they know what they're doing isn't working, or they say there's got to be a better way. So there's definitely a better way. I should mention that if anybody's interested, they can go to my website, lisabarrmd.com, and they can actually listen to part of the book on the audio. Sarah Molo Christensen is a wonderful book narrator, did a fabulous job, and so you can kind of listen to the early chapter of the book. And there's some content on the website. I'd love for people to sign up so I can keep them informed. I myself am in the process of starting a new practice, so I've got my entrepreneurial hat on. So I haven't been blogging as much as I would like, but certainly once the new year sets in and I get the new practice up and running, I'll be doing some regular blogging on health-related topics I think people will find interesting.
Absolutely. Can they also buy the book on your website as well?
Yes, there's a link direct to the Amazon site that you can buy the book, or you can go to Amazon directly and the book is available on Kindle, paperback, and audio.
That is fabulous. Well, again, Dr. Barr, I have to thank you. It's been such a tremendous conversation with you today. Thank you for coming to share your very important book, Outsmart Your Pain, because a lot of people dealing with pain, they don't have to. You can get a handle on it.
They don't have to. That's right.
Thank you, Dr. Lisa Barr,
All right.
for coming today.
Thank you for having me.
Savvy Business Radio broadcasts worldwide via a large podcast network, celebrating business owners, entrepreneurs, influencers, and successful individuals. Find out about our paid sponsorship opportunities or how to become a guest. Call 732-474-7375 or email Christina@savvybusinessradio.com.